Let's discuss diagnosis according to Qi, Sui, Jinye imbalances. The Sui heat. Blood heat can arise when exogenous pathogenic Qi invades the body and penetrates into the interior, or it can be internally generated. Like blood stagnation, blood heat will manifest with symptoms and signs that indicate that blood has lost its physiological properties and now has a pathological influence on the body. One of the main negative effects that heat in general has is that it agitates blood. This can cause blood to become frenetic and rupture the walls of the vessels, resulting in bleeding. Bleeding anywhere in the body can be due to blood heat, but it is especially prominent in heavy and prolonged menstrual bleeding or bleeding mid-cycle. The menstrual blood will be bright red in color, sticky, and usually with fresh, shiny clots because it is heat that is causing blood to stagnate. Blood normally anchors and nourishes Shen. If there is blood heat, Shen becomes agitated. This will manifest as mental restlessness, irascibility, and insomnia. If blood heat is more extreme, there can be manic behavior, delirium, or even coma. Many skin disorders are a direct result of blood heat, or blood heat is a major contributing factor. This is because blood should nourish and moisten the skin. If there is blood heat, blood will no longer be able to perform these functions and it will instead negatively affect the skin. This can be seen in skin disorders where the skin is dry, red, and swollen and feels hot to the touch. The heat can generate wind. This will cause the skin to be itchy. Blood heat in common with other forms of excess heat can manifest with sensation of heat in the body, fever, or an aversion to heat. When there is invasion of pathogenic qi that have penetrated into interior, the sensation of heat or fever will be worse at night because the yin aspect of the body is injured. Blood heat will also cause person to be thirsty because the heat endures and desiccates the fluid in the body. The tongue will be red and the pulse will be rapid. For the theology, blood heat can arise when a person with exogenous heat penetrates from the exterior aspect of the body down to the jing or blood level in the four levels. There can also be a residue from previous invasion of pathogenic qi that had been expelled from the body or from the vaccinations. These residues or residual pathogenic qi can generate heat in the blood. The liver is a reservoir for, for blood. If the liver is hot, it will cause blood to become hot. This means that factors such as consumption of food and beverages that are energetically hot, particularly alcohol and emotional imbalance, can be contributing factors. Symptoms and signs, there's skin disorders where the skin is red, hot, dry, swollen, or itchy. There's bleeding, short menstrual cycle, prolonged menstrual bleeding or mid-cycle bleeding, heavy menstrual bleeding, menstrual blood that is bright red, sticky and possibly clotted. Mental restlessness, mania or delirium, coma. Insomnia, fever, which may be worse at night, aversion to heat, thirst, red facial color, red tongue, rapid pulse. Key symptoms is red complexion, bleeding, bright red menstrual blood, mental restlessness, and rapid pulse. For the treatment principle, we have to drain blood heat. Acupuncture points use UB17, UB18, UB40, DO 14, spleen 10, LI 11, liver 2, pericardium 3. Needle technique is draining, bleed UB40, pericardium 3, and DO 14. Explanation, UB17, UB18, UB40, DO 14, spleen 10, LI 11, liver 2, and pericardium 3 all drain blood heat. Blood heat can be caused by the following pattern of imbalance: invasion of exogenous pathogenic qi, liver fire, stomach fire, heart fire. Blood heat can result uh, in the following pattern: liver fire, stomach fire, heart fire, yin deficiency, blood stagnation, blood loss. Thank you for your attention.